270 doctors have been appointed across the country. They were part of the 800 doctors who petitioned the National Department of Health for jobs. The department says it will be advertising more posts across the country. Joining us now is Dr. Mvuyisi Mzukwa from the South African Medical Association. He is the chairperson thereof. Dr. Mzukwa, a very good afternoon and thank you so much for joining us.
Afternoon to you, and your viewers. Thanks for inviting me.
Thank you for making time. So 270 of the 800 have understandably, or at least we understand, been placed in posts. Your reaction to that?
Well, thank you so much for that question. We believe that as the South African Medical Association, that, posts coming through for the unemployed doctors is we welcome that. But we are, skeptical, because we have not received any communication from our members. All we know is that most of them have done interviews in the public sector, and there has been no response so far. So we still have to verify the information that about 270 have been appointed by the Department of Health. I must mention that we've met with the department, in fact with the minister in Limpopo recently. And this question of unemployed doctors was raised. And actually there were some amongst the audience who were unemployed who posed questions there. And, we verified that actually their appointments have not been done as yet. Actually, the Department of Health, the minister and the senior executives were going to meet early April to verify information that will be presented by provinces, MECs and heads of departments, and tell us how far have they gone with the employment of these doctors.
Dr. Mzukwa,
we have noted though.
Yeah.
We have noted though. Sorry to interject.
Okay, go ahead. Go ahead. Finish it. Yeah.
Yes, we have noted that also. There have been adverts, from Limpopo of about 143 posts, and the Eastern Cape about 138 of those. So we're still waiting to see what is it that they are advertising, because in some provinces we're told it's shifts. And we have already indicated to our members that they should not sign those contracts without consulting first with the South African Medical Association.
Okay, if I'm hearing you well, Dr. Mzukwa, and correct me if I'm wrong, you're saying that this figure of 270 might not necessarily be true.
Yes, like I said, some of these colleagues who have done interviews were confirming to the minister that they've done interviews, but they've not been appointed. I mean, we're talking about just recently on a Friday last week. So we really have to verify this information first, because there's a tendency to want to make it public that, doctors have been employed when actually that's not the case. We know this when through the placement of interns and community service. When people would go out, officials go out and say, we have already placed interns and community service doctors. Well, actually, that has not been the case. So we're very skeptical of the information that has not been verified.
Are these posts, though, being advertised? Are you hearing from your members that posts are available, they are being advertised? As you mentioned that some of these 270, they did go for interviews, but as to whether they have been given the jobs, you are not clear on that.
Yes, let me say that we've only seen only two adverts from Limpopo and the Eastern Cape. Like I said, it was about 143 posts in Limpopo and about 138 posts in the Eastern Cape. So we are yet to see whether those are true appointments or just a publicity stunt. So, because we've seen in the past, we need to verify everything that is being said. But we are worried, because, if we're playing games with these doctors, these are young, smart doctors who are, are being attracted by other countries, outside of South Africa, like Canada and Australia. So if, the government is beating around the bush in terms of employing these doctors, we might face a serious challenge where actually they leave the country.
So, I mean, I'm looking at this again and saying that then how do you then, what's the level of communication between yourselves and government with the health ministry who have come out publicly and said that they will fix this problem? There are adverts that are being made there. How do you reconcile so that we know whether doctors are being given the jobs or not?
Like I said, when we had a meeting with the minister last week, and there is no confirmation of employment of doctors so far. The minister told us that they are going to meet with the provinces represented by the MECs and the heads of departments. And in that meeting, they will verify, information on employment of these doctors. Because we have insisted that these doctors need to be employed if we are serious about the NHI or a reform in this country. We need to employ those young doctors so that, we fill in the gap that has been left by COVID-19, but also by the retirement of some of these colleagues.
So what then will be the next step in this instance? From your side, as you're saying that even the number of 270 in comparison to the earlier 800 that was reported or that matched is still quite low. What would then be the next step in trying to remedy this situation? To your point, Dr. Mzukwa, in that these young doctors do not leave the country and take up jobs overseas.
Well, what we are going to do in the next week or so, we are going to send out a survey like we always do with the colleagues who are unemployed and find out who is employed, who is not employed. Not people who have done interviews. We want a letter of appointment so that we verify that that person is employed. So that's the next step. But also, just after the meeting of the minister and the provinces, our aim is that we're going to request a meeting with the minister to get information whether the provinces have really absorbed all these colleagues in the provinces, because we can't sit here and allow our young doctors, smart doctors, to be sitting at home who are fully qualified. These are not interns or community service doctors. These are fully qualified doctors who are ready, to give services to the country, who've been trained, properly trained, using taxpayers' money. We can't allow a government that is going to release them to other countries when we've got our own shortages.
And finally then, I mean, as you've mentioned that you are looking at having conversations with this, with the health ministry to try and clarify this. But from what you know, are there any of your members that at least have confirmed from the 800 that they've gotten jobs? Or are these jobs even available? Maybe I should go that direction, Dr. Mzukwa. Are these jobs available, as far as you know, to be taken up by those doctors?
Well, Gwen, like I said, only 2 provinces have sent out adverts. Only 2 provinces. And
how many positions, like arguably, how many positions would that be? Rough figure?
It's about 140, around 143 in Limpopo, 138 in the Eastern Cape.
Okay. So those are the only 2 provinces that have released this particular post.
That's correct, Bernard.
All right. Dr. Mzukwa, we're going to leave it there, but thank you so much for coming through and